Hi, I am here to inform my audience of my COM 110 class about peritoneal cancer. Before this year, I would never have been able to tell you what primary peritoneal cancer was. I honestly probably wouldn't even know it existed. As I've done more research about it, I can very easily tell people about it. This type of cancer did not just spark my interest or show up on my phone. This type of cancer means a lot to me because my aunt just recently got diagnosed with it. A couple of things that people need to know about this certain cancer is what exactly is it, what are the symptoms, where is it located, and where could it potentially spread to, and what are some of the treatments. You might be wondering what primary peritoneal cancer is. This type of cancer is very rare. Less than 7 in a million people have it and will end up getting it in their life. The people who do get it are most commonly women. Not very many males can get it. This is because most times the cancer is developed in the female reproductive system. If a man does end up getting diagnosed with this cancer, it is likely that it will be located in the lining of the abdomen or in the groin. It is caused when multiple cells multiply at a very fast and abnormal rate. This is my main point. The second main point is where this cancer is most commonly found. Since this is most commonly found in females, you can probably guess that it's found in the uterus, the bladder, the rectum, or maybe the fallopian tubes. The most common place for this cancer to be found is in the lining of the abdominal wall called the peritoneum. This is the main reason this cancer is not found in men very often. There are many things to expect to happen when being diagnosed with peritoneal cancer. Many of the symptoms do not show up until later on, but when they first show up, the first symptoms are things like abnormal swelling and pain, frequent urination, fullness when eating, changes in bowels, and sometimes weight loss. Later on, after being diagnosed, more symptoms might occur, such as buildup of fluid in the abdomen, abdominal discomfort, nausea, and vomiting, and maybe shortness of breath. As the cancer gets worse, the more the symptoms start to show up. The fourth main point is the treatment methods that are used for treating this cancer. There are many things that doctors can try to do to cure this cancer, such as surgery. If the patient wants to go this route, they would have it removed wherever the cancer is. For example, if the cancer is in the ovaries, uterus, or fallopian tube, they would remove that part of the reproductive organ. If the cancer is in the peritoneum, the fatty tissue inside of the abdomen would have to be removed. The main goal of surgery is to remove as much of the cancer as possible. Other methods that are used are therapy. There are many different types that can be used, such as targeted therapy or hormonal therapy. Targeted therapy is used for more advanced cases of this cancer and is the last resort. This is also used if chemotherapy does not end up working. This type of therapy stops the growth of the blood vessels. The next type of therapy is hormonal therapy. This is also a last resort therapy, but instead of it being used if chemotherapy does not work, it is used at the same time. This therapy uses hormones to try to fight against the cancer. The best and most efficient way to treat this type of cancer is, just like many others, chemotherapy. Many people have probably already heard of this. For those who know of chemotherapy but do not necessarily know what it is the use of powerful chemicals to kill fast-growing cells quickly. Many people ask, can this cancer spread? And the answer is yes. There are many different stages of peritoneal cancer. The worse the cancer gets, the more places it will spread to. At the start of the cancer, it might be only in the ovaries, but by the time you catch it and start getting treated for it, it could possibly be in the fallopian tubes or in the lining of the abdomen. There have been times where this cancer has spread farther than the normal limits. There have been 6 cases where this cancer has spread to the brain. The most common organs it has spread to are the lungs, liver, and lymph nodes, but it is not common that this cancer spreads farther than those. All of the main points, like what is peritoneal cancer, where can it be located, can it spread, what are the treatments and symptoms are all the facts that someone needs to know to become more familiar with this rare cancer. It is important to learn about new things and things that are not as common. Things are not as common and cancers that aren't as common, such as breast cancer or skin cancer. Although this cancer is very uncommon and there is very low chance of getting diagnosed with it, learning and knowing about it is still important. I got all of my information from foundationsforwomencancer.org, webmd.com, cedarssinai.org, cancerinformation.org, and utswmed.org.